The new set of upper and lower expanders came in at the beginning of October. The plan is to wear the upper only for 3 months and let it get a head start, and then add the lower to daytime wear. I made the expanders so I can get lower jaw advancement at night again. I had to figure out a new combination of rubber bands to get me the correct amount of lower jaw advancement so my sleep was acceptable. It's always a bit of trial and error to have enough lower jaw advancement while not creating muscle or jaw pain. The expanders are a bit of a catch-22 initially with the sleep and breathing, because although they're growing the jaw to make more room for the tongue, initially they are just taking up more tongue space due to the acrylic on the roof of the mouth. One of the things that I love as a dentist is continuing education. It helps me serve and treat my patients better. If there's something that I feel like I can learn to help me take better care of my patients, sign me up. Most patients who have trouble with sleep and breathing also have problems with their jaw joint. The reason is that because breathing is so vitally important, the body will do whatever it needs to do to compensate so we can adequately breathe. Sometimes this can be a detriment to other parts of our body. It can cause pain throughout the body, even though the main source of the pain is the jaw joint. The body will compensate however it needs in order to make sure it's getting vital oxygen that is needed for survival. The jaw joint is unlike any other joint in the body, so it is more complex. I realized that this was one of the missing puzzle pieces in order to serve my sleep patients. There was a series of 3 courses I had had on my radar to take for a few years now, but it never worked with my schedule. I signed up for the first course in September of 2022. What I learned is that poor sleep, breathing, and pain all go hand in hand. We are able to help patients with orthodontic expansion and/or sleep appliances, but if they have an underlying jaw joint dysfunction, those treatments can sometimes aggravate an underlying condition. The system for treatment that I learned from Dr. Stephen Olmos is proven to help the jaw joint heal in order to provide relief with sleep, breathing, and pain. At this course, I learned that prior to orthodontic expansion, it's ideal to stabilize the jaw joint and take care of any underlying problems that it may have. I didn't have a lot of head or neck pain on a regular basis, but I always knew that I had some sort of underlying jaw issue due to my sleep breathing problems. My jaw had gotten locked open a couple times over the last 10 years. I would also have occasional popping in my jaw joint when I would open really wide. Sometimes, if I chewed gum for an extended amount of time, my jaw muscles would get tired also. Prior to treating my sleep, I would wake up in the morning and I could tell that I'd been clenching my teeth during the night. I hadn't dealt with a lot of pain over the years, but I've been seeing a chiropractor once a week for the last 4 years. Dentistry is very hard on the body due to the positions we have to hold ourselves in to do procedures. Since I see the chiropractor once per week, it really helps me keep things in check. I recently had developed pain in my left hip after going on an extremely long hike in September. It would sometimes ache at night, and it affected my workouts that I do on a daily basis. Even with weekly and sometimes bi-weekly chiropractic adjustments, I was having difficulty getting it to resolve. Part of me wondered if this was related to my sleep, breathing, and jaw joint issues. Treatment for the TMJ involves wearing a daytime lower appliance that decompresses your jaw joint, and then a nighttime appliance that continues to decompress the joint will also improve breathing and sleep. If the patient has the jaw joint as the primary source of pain and inflammation, it causes the body to compensate. We swallow upwards of 1,800 times per day, and every time we swallow, the jaw joint pokes the disc between the jaw and the skull, which just exacerbates the inflammatory process. Decompressing the joint gets rid of the source of inflammation and irritation, and thereby it allows the body to start the healing process. Typically, a patient only has to wear a daytime appliance for 3 to 4 months, which allows the body to heal. As the body begins to heal, the brain no longer sees the joint as the primary source of pain. So the pain will then migrate to other areas of the body as the original primary source has been resolved. As dentists, we're able to help with some of those sources of other pain areas, but many times we need to refer to chiropractors or physical therapists in order to get the body back into alignment. After taking the second session of the jaw joint course, I realized that I could benefit from this treatment. Since I just started wearing my expanders again and was only about 6 weeks in, the idea of discontinuing their use and starting this treatment was disheartening. Initially, I thought I would wait until I was done with the expanders and then do this treatment prior to going back into clear aligner trays. But then the idea occurred to me that what if I could do both at the same time? Since the upper expanders cover the chewing surface of my upper teeth, it's decompressing the joint when it's in. The only problem is that when I take it out to eat or talk, the joint is still getting aggravated. So I decided to make myself a lower daytime TMD appliance so I could have continual decompression. The only thing is that I was planning on beginning daytime wear for the lower expander around January 2023. That would be the same time I would receive my lower TMD appliance. What I decided to do was slow down the turns for the upper expander to once every 3 weeks instead of every 2 weeks. I will monitor the upper expansion closely so that the upper jaw doesn't get too far ahead of the lower. I was really excited about this idea because although it will require me to wear my upper expanders a bit longer, I'll be able to allow my jaw joint to begin the healing process. I'm also very hopeful that my hip pain will begin to resolve. Patients who don't breathe or sleep well are most times in sympathetic dystrophy. What is sympathetic dystrophy? Basically, it's where our body gets stuck in a fight or flight state. The body being in a chronically stressed state due to poor breathing and sleep. Symptoms include rapid heart rate, poor digestion, and cold hands and feet. When we begin to improve the breathing and sleep, the body is able to rest and repair. I have had cold hands and feet for quite a while, as well as some occasional digestive issues. Quite a few years ago, I cleaned up my diet immensely, and so now I have less digestive issues. I'm hoping that with treating my TMJ dysfunction, I will be able to get out of sympathetic dystrophy, sleep better, and have less pain.